Hello everyone. I'm so sorry that I haven't been able to post. I've been very sick lately and I have not been able to post because I've been having pain and I couldn't. I was just too weak to do it. So now I'm back. Yeah. Now I want to just explain what sickle cell disease is, what it entails, what the cause is, what type of sickle cell they are. There are many types, but I'm going to mention two, and some other stuff like that, cure, treatments, and stuff like that. Sickle cell disease is a group of inherited red blood cell disorders. Healthy red blood cells are round. They move through small blood vessels to carry oxygen to all parts of the body. In someone who has sickle cell disease, the red blood cells become hard and sticky and look like a C-shaped farm tool called a sickle. The sickle cells die early, which cause a constant shortage of red blood cells. Also, when they travel through small blood vessels, they get stuck and clog the blood flow. This can cause pain and other serious problems such as infection, acute chest syndrome, and a stroke. Now, I'm going to mention two types of sickle cell disease, one of which is the one I have, HBSS. People who have this form of sickle cell disease carry two sickle cell gene S, one from each parent. This is commonly called sickle cell anemia, and this is usually the most severe form of the disease. People who have HBSC inherit one sickle cell gene S from one parent and from the other parent an abnormal hemoglobin called C. A hemoglobin is a protein that allows red blood cells to carry oxygen to all the parts of the body. This type of sickle cell disease is a milder form. The cause of sickle cell disease. Sickle cell disease is a genetic condition. You can't get it. It's genetic. That is present at birth. It is inherited. When a child receives two sickle cell gene S one from each parent. The diagnosis. Sickle cell disease is a simple blood test. It can be diagnosed with a simple blood test, but it is most often found during birth, routine newborn screening test at the hospital. In addition, sickle cell disease can be diagnosed before birth. Because of children with sickle cell disease at increased risk of infection and other health problems, early diagnosis and treatment are important. Like now, if you find out late, which is very bad, it can start to destroy your organs and stuff like that. And then it gets worse from there. You can call your local sickle cell organization to find out how to be tested. Complications and treatments. People with sickle cell disease start to have the symptoms during the first year in their life, usually around 5 months. And I was diagnosed when I was just, I think, 5 months or so. So, symptoms and complications with sickle cell disease are different. They range from mild to severe. There is no single best treatment for all people with sickle cell disease. Like now, it's just like saying, for instance, let me use an example. Like now, if you don't like ice cream, another person can love it, and you might be allergic to it and stuff like that. That kind of goes for sickle cell disease. The same treatment, you can't get the same thing cannot work for everybody. Treatment options are very different for each person depending on the symptoms. The cure, the only cure for sickle cell disease actually is sickle cell. The only cure for sickle cell disease is bone marrow or stem cell transplant. Bone marrow is a soft fatty tissue inside the center of the bones where blood cells are made. A bone marrow or stem cell transplant is a procedure that takes healthy cells from a blood donor and puts them into someone whose bone marrow is not working properly. Bone marrow or stem cell transplants are very risky, can have serious side effects including death. For transplant to work, the bone marrow must be a close match. Usually, the best match is usually your siblings or someone that is close to the family, like not far from the family. Bone marrow or stem cell transplants are only used in case of severe sickle cell disease for children who have minimal organ damage from the disease. And yeah, that's it for today. I would get back to you guys on more information. I'll explain more what a hemoglobin is. You guys are going to see me go through my own transplant. My donor is my sister. She was like, I think 100% match. And yeah, I'm going to take you guys through my transplant and all that. You guys are going to see what it is, how it works. You're going to see the 6 or 7 days of chemo, depends. And yeah, see you then. My next video will be posted on Monday. Bye. Like when you walked out my life, why you walk out my life?